Hello, everybody, and welcome to our seventh episode of the Community Health and Capital podcast that we're running at the 19 Hills Community Interest Company. I'm really excited to welcome today Pippa Britton. Pippa is the Vice Chair and Independent Member of the Nairn University Health Board. Hi, Pippa.
Hi.
And it's really lovely to have somebody from the Health Board to talk about not just the Wellbeing Centre at 19 Hills, but the general direction that we're trying to go to with these integrated centres. Do you want to tell us a little bit about yourself, Pippa, before we start?
Yes, I'm. I suppose a few people know me as a Paralympian in archery, as which sounds like a bit of a strange route to get through to being vice chair of an Iron Health Board. But I was always interested in governance and the opportunity to make a difference to people's lives. I think I often say to people that if you want things to change, you need to be in the room where the decisions are made. And I was an athlete representative when I was on the archery team, and I was able to influence some change that led to some important changes for athletes. And I saw that as a route forward. I want to make a difference to people in my community, and so that's why I applied to go onto the board. I became an independent member of the board initially, and then I became vice chair. I think it must be about 2 years ago now. So yes, I really enjoy it, but it's quite challenging.
You have joined not the easiest of times immediately after the pandemic, but time obviously sounds like it's flying.
Yes, yes. Lots of things have changed through the pandemic as well. Of course, we do lots more things online. When I first joined, lots and lots of meetings in person. I think there's a real opportunity actually um, in those changes that have come through the pandemic, given us the opportunity to actually meet more people. We're speaking at the moment, aren't we, virtually? But there's that real opportunity, isn't there, to make use of some of the technology that we were forced into using through the pandemic. So whilst it was not a good thing at all in terms of the number of people who either died or who were left with actually lifelong conditions, I think that there were some things that we have to take the positives from.
Hmm. I think that's really interesting, actually, before we get into the heart of the conversation today, because we're really interested in our community interest company about how do we harness all of that energy and drive to use technology in a new way and to innovate and maybe to innovate quicker, because we saw changes happening inevitably faster, but many colleagues, I suppose, have commented that we hoped we wouldn't go back to the kind of pace of slow change that inevitably started, used to happen. I guess it's up for debate if we've still seen that innovation happens as fast as it happened during the pandemic, but we want to make sure we complement that with the recognition that social connection is just so important for people's health.
Yes, but social connection in person, I think, is also vitally important, and we should never underestimate the use of pieces of paper either. You know, a piece of paper that you can pin on your fridge, for example, is a reminder of you know, if you want to go to a community centre or something, you know, it it's good having things that are online, things that advertise, things that we see on Facebook, social media, but it's also really important to people to be able to pick up things and read them and to discuss them with other people. I think, you know, that's something that we absolutely shouldn't forget. And there's been a lot of studies done on how we all communicate, and we've got some people in society who don't own smartphones, and we should absolutely never forget that. um, and some people who'll never listen to this podcast, but hopefully they'll meet somebody who has, and they'll have a conversation about it. So we
Yeah.
shouldn't forget those kind of human interactions, which I
No,
guess
absolutely.
brings you a little bit onto 19 Hills, doesn't it? In terms of it being a centre where people can meet, as well as hosting medical centres, shall we say? I don't know if that's quite the
Absolutely.
right word.
Absolutely. So obviously this podcast isn't necessarily primarily and only for the 19 Hills Health and Wellbeing Centre in Ringland. But our community interest company does see that there is a value in integration of different services, of trying to talk about a different model of health and well-being that isn't so much about the medical aspect as it is more about the social. And there's lots of work that we see, the could be done around, involving people in the management of health and care services, in participating in a voluntary capacity. But obviously, this specific centre has been many years in the gestation. Where do you and what really is, do you think, the vision from board for these centres that are spawning up around Gwent?
I think um, really speaking, it's about providing quality for people, and quality and choice, and a kind of the opportunity to have a one-stop shop. Now, that one-stop shop might not actually be for everyone, but if you can have somewhere where you you can go and see a physiotherapist because your knee is hurting and you don't actually need to bother the doctor, for example. So those kind of direct interactions, I think, can be really important. I think the the opportunity to have charity engagement, voluntary engagement, and we just don't know in health, I think, and generally speaking, actually, I think most people in society don't know what they don't know. They really don't know how many people there are volunteering, how many charities there are who are making a difference to people's lives. And Wales is a country where they've got more micro charities than any other part of the UK. And these are things that people are literally setting up on their kitchen table to make a difference to a small pocket of community. We hear a little bit about it, don't we? We hear about food banks, and there are things that we hear about. We hear about the big charities and the work that they do, Age Cymru, for example, or Macmillan, or all sorts of charities we hear about, but we don't hear about the small charities making a small difference, or even just people volunteering in their neighbourhood who are popping in to see half a dozen elderly people to say, do you need some shopping? Or we miss quite a lot of that in society. We just don't know everything that goes on. And I think there's an opportunity within a community when you bring people together for people to share what they do and to speak to each other and say, oh, that's a good idea, I'd like to be involved. There's a great example of a young man who won an award, a St. David Award, about 3 or 4 years ago. I think it might be a little bit longer. He was one young man who he was about 16, and he decided he was fed up with rubbish and fly tipping. And he started off by just collecting rubbish on his own. And then he enlisted a few friends to help collect rubbish. And then he earned a little bit of money and he installed some security camera to combat fly tipping. And he ended up with a whole kind of community that was galvanized into making sure that the mountainside around where they lived was not covered in litter. And that's what you can do, isn't it? It's somebody making a big difference. It's like putting a pebble in a pond. They start off with one small pebble and then it grows and grows. So I think community integration, that's what we can get out of it if we bring people together so that they can actually find out what's going on.
And there's a huge amount being talked about, hasn't there? Asset-based community development, obviously kind of Cormac Russell being the kind of major proponent of that whole approach or agenda. It doesn't come naturally to us in the health service, does it? That kind of idea that we step back and let other people take power, I suppose.
And I think some of that comes from the fact that money within health it's my money, it's your money, it comes out of taxes. So this is public money that gets spent on health. And then I think there's a kind of a bit of a concern about, well, if you are spending the money, you can have the control over how it's spent. But what happens when things are happening outside your control? And what risk is there to I don't know, if to somebody elderly, for example, what risk is there if we're not stepping in to help them when they need help? Or social services, again, publicly funded, what happens if they're not stepping in? How do we know that people in the community are providing the quality, and the safety that people need? And I think that's possibly where some of this kind of reticence has come from. So you've got two things going on there, haven't you? You've got one of saying, well, we don't actually know what's going on, and then we've got the other one going, well, we can only control the things which are within our spending power, if you like, and then we can ask the questions. We can ask the questions: are you doing it right? Are you doing it well? Are you being safe? But it's very difficult to ask those questions of people who are just providing all of that additional service, all of those unpaid carers that we've got out there. That this is stuff that is going on already, but it's quite difficult, I think, for health to have any control in that. So I think that's historically where it's come from.
It's a very new way of working, isn't it? But I suppose we're never going to keep people well at home unless we build that community resilience.
Absolutely. And keeping people well at home, in all you need is to just check in on your elderly neighbour, let's face it. And those sorts of things are the things that make the difference. That, if you have an elderly neighbour and you offer to do their shopping, or you just check in on them, this is just as an example, then maybe you're the person who says, oh, you're looking a bit peaky today. You don't have to be medically trained to do that.
No.
So I think there's something, isn't there, in those micro interactions that we have, just so important for us all.
It's always stuck with me, the fact, I think they looked at it in one of the biggest heat waves in Paris in France several years ago. The biggest risk factor for, people sadly passing away was living by yourself, not having anybody check in on you. Because of course, if nobody's checking in on you, if you've got food in the house, are you hydrated enough? Really, are you okay? Public health often talks about the risk factors for people's health being smoking and alcohol, but probably living by yourself and being socially isolated is one of the biggest risk factors of them all.
Yes, and falls are a big problem, aren't they, for lots and lots of people, I think. And that's something else, that it's one of those things that can be noticed. A small fall is not catastrophic, but is generally, I think, there's so often those things are an indicator that you just need a little bit more help around the place, possibly.
So Pippa, to circle back, because we've spoken there about, I suppose, there's lots of different aspects to integration. The big one you've rightly focused on there is, one of the biggest areas that we have to think of all, really. How does it integrate into the community, and how does it integrate with the community, and how can we involve the community both as service users, but in a kind of civic aspect, but also kind of, I suppose, kind of strategically. Integration is spoken of a lot between health and social care, but perhaps sometimes we haven't even got our own house in order sometimes with the kind of integration, even within health, within the NHS. How would you perhaps see integration working in one of these large centres with 30 plus services under one roof, be it between health or the local authority as well?
I think some of it's around meetings, and that might sound like a really boring thing, but actually it's about learning from each other. And so I think if you have a dentist and you've got two GP practices and you've got social services and whoever it is, a pharmacist, for example, doesn't matter who you're talking about, I think there's that opportunity for sharing good practice amongst yourselves. I think there's also an opportunity for the kind of shared back office as well, because it's the people who are doing things like making appointments, that if they can share that information between themselves, if you've got I don't know, let's say a dentist and a doctor, just for the sake of argument, and you want to share an appointment making system, then or the people working in the same area, there's always that opportunity, isn't there, for the sort of people call it the water cooler moment or the coffee machine moment, where you can have an interaction with each other. I went to a conference a little while ago, and I was sat at a table with two district nurses, and another district nurse from somewhere completely different presented something that she was doing. And the two nurses sat on the table with me, said, "Oh, that's a good idea." And so there's something, isn't there, about those interactions that you have that can improve service generally. So I think those things help. I think there's also a certain amount of, can you can you get support as an individual? So as an individual practitioner, if you say, well, I'm not really quite certain about this, so I'm going to go and ask Joe Bloggs because he's just
Mm,
around the corner, Dr. Joe Bloggs, or whoever it happens
mm,
to be.
mm,
But so I think there's something in those, you want to call them economies of scale. Hopefully you
mhm,
can reduce some costs by sharing back office. But I think there is something about, if you are presented with someone who has complex needs, that you can say, well, actually, this isn't something I can take care of. But what I can do is I can send them just across the hall to social services, and social services can pass them on to somebody else, perhaps say, well, we can deal with this bit of your complex case, and maybe we can get, I don't know, somebody else involved to take care of that. And I think that integration is where you can provide real value to people, because the worst thing in the world as a patient, as a person attending, is for you to book an appointment with the nurse practitioner because you don't know who you should see. And you see the nurse practitioner who says, well, actually, this is quite complex and I'm a bit worried about that. So you'll have to get an appointment with the GP. And then you go away, and then it's 2 weeks before you can get a GP appointment.
mm,
And the GP says, well, that's great, but I can't take care of this. So I need to place a referral to somewhere else. And
mm,
you've got one person who is going, if you don't have it all in one centre, who might be going, from Ringland to the
mm,
Gwent
mm,
to, I don't know, to the Civic Centre to Cwmbran. It could be all sorts of things. And you're placing a huge burden on people and extending the time that they're worried, which is
mm,
no good for their well-being. So to have services where they are all together, where you can condense the amount of time that people are taking, have that kind of one-stop shop, I think there is real advantage to that for many people. And I don't think it will suit everybody. I think it's I think there are people who would much prefer to go somewhere that is smaller,
mhm,
quieter.
mhm,
Um, you know, people who want things run in the way that they were run when they were growing up, or there will always be space for something different. So I think we can't put all of our eggs in one basket, as it were, and say the integrated model is great for everybody. I think increasingly, as our generation of people who has grown up with the internet, smartphones, etc., and we have to think, don't we, that smartphones in their current role have only been around for about 15 years. So all our 15-year-olds who have never known any different, been born into a world of touch screens, and they, well, by the time they are 65, 75, 85, I think we'll probably see lots more in the way of integrated centres. But I think at the moment, there are still people who want a slightly more old fashioned model. Of course, the other advantage of new centres and bringing everything together is that we can start to think about inclusion, and we can start to think about accessibility,
mhm,
which traditionally we've not been very good at in this country. So I'm a wheelchair user, and there are some medical centres and doctors' surgeries, for example, that I can't go to, completely inaccessible. So that's something that gives us the opportunity to provide bus services and cycle paths and car parks for those people who need to drive. I think those integrated centres give us the opportunity to plan healthcare in a way that it hasn't been planned. It's just kind of evolved as time has gone by.
I think there's something there that's really interesting around how do we involve people at earliest stage on the design and the feel and the experience, because there's so many different aspects that need to be taken into account, um, to the point of how do we know if people with dementia feel comfortable coming into these spaces? Do we end up recreating clinical hospital looking spaces that actually ends up re-triggering people who went to A&E after a very horrible and traumatic experience previous in their life, really? And I don't know if we've always really nailed that in terms of speaking to different groups of service users to say, well, these are our designs, but how would that feel to you, and walk people through with it?
Yeah, I think that is really interesting. And I think we design spaces for the people who work in them, not for the people who are going to use them necessarily. And they are two different groups. And some things, of course, are going to have to be clinical, because, by their very nature, you need to think about infection, and, we can't have everything looking like somebody's living room. But you're right, we should involve people more. And I wonder as well whether or not there is space for us to think about, when we're building places like this, actually building in gyms and playing fields and those sorts of things, so that we actually bring sport into the whole well-being agenda. And that requires more space to be thinking about when you're first, going, well, what's the piece of land that we can use? And we want a piece of land, don't we, that's actually within walking distance of a lot of people's houses, or within distance of the mobility scooter or the bicycle or whatever people want to use. And then to find somewhere, where you've also got space for kids to actually play while they're there, and space for somebody to say, do you know what, I'm not going to prescribe you with this drug. What I'm going to say is, why don't you go around the corner to the gym and see Mary or Joe, and we'll put you on some weights, and you'll get a bit stronger, and that will be something that will give you a different focus to your life. What about swimming pools? That's the other thing that's amazing, isn't it? When you mentioned dementia, and there's quite a lot of work done by Swim England a few years ago on how swimming can really help people with dementia, because it's something very often they learn when they're young. And it's a little bit like, the people say it's like riding a bicycle, when you haven't been in a swimming pool for many years, but you remember how to swim. But of course, it's safer for somebody with dementia to be in a swimming pool than it is for them to be falling off a bicycle, I think, and trying to cope with traffic, or, it's much more contained, isn't it? So they did some really interesting work. And some of the work that they did was just around, how do you signpost people once they get to the swimming baths, so they, I guess, follow the blue line kind of idea, so that they can learn a simple path. Because a lot of the automatic things of, wearing a bathing costume, getting in the water, that they found people just took to, like singing, for example, is another thing, isn't it, where people find, people with dementia still enjoy singing, and they remember the words of songs that they had heard years ago. So I think there's some really interesting things there that we could be talking to our people in our community, and the people who work with them, and their parents and friends and loved ones as well, in order to make the environment as good as possible. And also, I think, linking stuff as well, because we get a lot of rain in Wales. I think, there's that opportunity, isn't there, of saying, well, we've got a bit more space to develop something, how do we link it so it's all undercover, so people will go from one space to another.
No, I think that's really interesting. I suppose these new buildings are expensive by their nature, aren't they? And it starts to make us think, going back to how we talked about, how do these centres and services strengthen community resilience in terms of people's skills and roles, but also kind of as an anchor, how does it contribute to the foundational economy in terms of creating jobs for the right people, or kind of building the kind of ecosystem in an area that promotes health, be it through sport or music or arts or anything really. None of this is easy, of course, really. And I think a lot of it's been tried before. And I think you've touched on some of the challenges, throughout this. And I think it was really interesting what you brought out there in terms of, the bedrock of all of this is relationships, isn't it? It's relationships, the community, relations amongst the staff. How do we nurture this type of way of working? And what do you think some of the kind of methods of how we could actually let this develop and unravel?
Yeah, so that's, I think, there's a thing, isn't there, around the people talk about culture, culture of an organization, but there is something around how friendly people are, how welcoming spaces are, and there's an expression that says a leader is somebody you want to follow. and there's something about spaces that you want to be in, and not spaces where you feel like you're just a number. And I think that's the when I spoke, didn't I, a little bit about people who want to access a single GP practice, for example, because they want to see the same person every time. They want continuity. You've got something wrong with you. You don't want to have to explain it 6 times to 6 different people. What you want is you want to see somebody and for them to understand how you feel, and for you to feel supported, not just like you're another number through the door. So it's most important, I think, that we are welcoming to each other. And I think that is true whether you're talking about the relationship between social services and a GP practice, for example, or whether you're talking about, me visiting my GP and the receptionist being nice and welcoming, and then the space that I'm in not feeling, you mentioned it, too clinical. So there are a number of things that affect how we feel in the round when we go somewhere. We all know if you go to Tesco's and the person on the checkout is nice to you, actually it makes your day, doesn't it? Because you have a very pleasant experience while you're packing up your shopping. And I think that that's the thing that we need to nurture. And I think there's something around what we do with recruitment as well. And being really inclusive in our recruitment practices, because we all like to belong to a tribe, don't we, as they say. There's people who look like us, talk like us, those sorts of things. And in recruitment, very often what we do is we have an application form, got lots of boxes to fill in, and at the end of the application form it says something like, and we welcome applicants from diverse backgrounds. And actually that doesn't feel very welcoming to me, that it's right at the end of the form. What we need is a statement at the head of every single application form that says, this is who we are. We're a great organisation. We want everybody to come and work for us because we've got a culture where we support our staff, where we want to give the best to our patients, to our users, to our community, and please fill in this form. That's what we need to do so that people feel from the very first moment they encounter us or encounter you that they are welcome. And that, I think, breaks down a lot of barriers before they even encounter. People are much more willing then to have those conversations that say, well, actually, we haven't got enough money to do this. So is there another way around it? And rather than just saying, sorry, no money, there's something, isn't there, about how do you build those things constructively? And I think it's a good starting point.
Yeah, the environment and the feel of it makes a huge difference. And you've talked about the need to protect time for staff to kind of get to know each other and the importance of that, not just focusing on those that are delivering care and are public facing, but the kind of back office and those in management and admin roles as well. Thank you, Pippa. This has been a really, really interesting conversation. We're really, really grateful for your time. Is there any kind of last words you wanted to give and kind of, your hopes and aspirations for this, or kind of what direction we could go in?
Well, I think the first thing that I would like to say is actually I'd like to extend a thank you, because I'd like to extend a thank you to the community who've been involved in all of this, but also a thank you to all of those kind of unsung heroes out in the community and the people who are volunteering and who are making a difference to others' lives at the moment. Because I do see the whole 19 Hills project as having that kind of ability to just reach a bit further into the community. But I do think we don't say thank you often enough, and it feels like a really great opportunity to me. And I kind of hope that it really gives people what they need and what they want, and isn't afraid to evolve over time, because we all know that we don't get things right first time, even however hard we try. And it's about how do we get feedback from people? How do we know we're doing it right? How do we know what we need to change? And then once we know what we need to change quickly if we possibly can. So I think those are kind of a couple of thoughts I had right at the end.
Lovely. Thank you, Pippa. Well, thank you again for your time today. This has been the seventh episode, as we mentioned, of the Community Health and Capital podcast. If you've got an idea for another episode or want to get in contact, feel free to contact us on social media or info at 19hills.org. And we look forward to sharing another episode with you shortly. Thank you again, Pippa.